Now I want to focus on the evening's featured guest, our 2020 recipient of the Pro Bono Humanum Award for Global Health Equity, my friend and fellow physician, Dr. Bill Foege. I can think of no one more significant and qualified for this award, not only for his 5 decades of service to the global fight against infectious disease, but for the personal and professional touch points he has with nearly half of the 13 previous winners, including myself. Our relationship began when Bill served as director of the Centers for Disease Control and Prevention, CDC, from 1977 to 1983, and I was head of Merck Research. Later, in 1987, when Bill was running a then unique multi-sectoral collaboration called the Task Force for Child Survival and Development, simultaneously serving as executive director of the Carter Center, I was Merck's CEO. We decided to collaborate with his team on Merck's Mectizan drug donation program to eliminate onchocerciasis, a parasitic disease that causes blindness, then endemic in many African countries. It was the start of a successful industry NGO partnership that continues to this day. That success is replicated by his leadership of other innovative disease surveillance and eradication campaigns against guinea worm, polio, measles, and above all, smallpox, which up until that time was finally snuffed out for good in 1980, had killed 300 million people in that century alone. While no victory over disease is attributable to one person, when it comes to smallpox, Bill Foege comes close. His work began when he served as a young medical missionary and epidemiologist in West Africa in the 1960s, and continued at the CDC as head of its smallpox eradication program. It was there where he pioneered the surveillance and containment measures that are today recognized as central to the effective management of mass infections with minimal use of scarce resources. His were the collaborative, culturally aware, and field-based strategies that secured what is still considered the single biggest achievement ever in international public health. I would be remiss if I didn't mention that Bill was among the earliest to advocate public health as a global issue and to document the interrelationship between health, social policy, and economic development. Back in 1984, he co-chaired what was the first truly multilateral initiative to address these issues in a global context. The Task Force for Child Survival and Development helped launch programs that vastly extended global childhood immunization. It proved to be a groundbreaking exercise in health empowerment for underserved populations worldwide. Its work continues today as the global Task Force for Global Health, supported by the Bill and Melinda Gates Foundation, where Bill also has deep, extended roots as a senior medical advisor and subject of the Foundation Fellowship Program for young professionals in diverse fields of public health. Finally, if you think that after his long career, Bill is simply resting on his laurels, think again. Earlier this month, the National Academy of Medicine published an expert report on equitable access to COVID-19 vaccines, co-chaired by Dr. Bill Foege and a former CDC colleague, Dr. Helene Gayle. 18 leaders in health contributed to its consensus recommendations, which I'm sure will serve as a key guidepost on just who gets the vaccine first. Once again, it puts Bill Foege in the forefront of what is good and equitable for public policy in health. On September 23, 2020, just a month ago, he sent a private letter to CDC Director Robert Redfield, urging him to acknowledge in writing that the CDC had responded poorly to COVID-19 and to set a new course for how CDC would lead the United States' response, calling the White House's approach disastrous. Bill, it gives me great pleasure to award you the 2020 Pro Bono Humanum Award for Global Health Equity. Congratulations. Please say a few words.
Thank you very much. I want to express my gratitude for the award and the particular pleasure it gives me to have my name right next to Roy Vagelos, and I'll tell you why. When I was 15 years old, I was in a body cast in a small town that had not yet received television. And so I could not roll over or do anything, but I could read. And I began doing a lot of reading. And one of the areas that intrigued me was the story of Albert Schweitzer, both books about him and books written by him. And I developed an interest in both Africa and medicine because of that. When I went to medical school over 60 years ago, it was a surprise to find very few people who had any interest in global health at all. But I did find one. His name was Ray Ravenholt, and he just in the last month died in his 90s. He said to me, there's no clear path into global health. But if you're really interested in this, go to Atlanta, Georgia, and try to become part of the Epidemic Intelligence Service at CDC. And that is what I did. And it turned out to be such good advice because the history of global health I found very intriguing. You have the chapter on church groups doing medical missions. And in each area of the world, they seem to use a different approach. Denominations used a different approach, but they were very interested in diseases that other people did not want to deal with, such as leprosy. Then there was the whole colonial period, and you can see the difference between what the French and the British and the Portuguese did in different parts of the world. There was the chapter on military research because there was an attempt to keep troops healthy. There was the interest of the Rockefeller Foundation a century ago. And even before the foundation, the Rockefeller family gave money to the London School of Tropical Medicine. But then they also helped start the public health schools in the United States. They worked on trying to develop a vaccine against yellow fever. And it's an inspiring story because they started a lab in Nigeria trying to isolate the virus. And one of their people ended up getting yellow fever and dying, one of the scientists. A second scientist there did the autopsy on him and acquired yellow fever during the autopsy and went on to die. A third one developed yellow fever and died, and still they persisted. And eventually they did isolate a virus. They brought it back to the United States, worked on it at the Rockefeller Foundation, and developed the vaccine that we still use today for yellow fever. And they got a Nobel Prize for it. An exciting history of global health. During the Second World War, of course, there was a lot of work being done on global health. In the United States, a malaria program started to try to protect troops, particularly in the South Pacific. But after the war, there was an increase in the effort. So we had global agencies such as the World Health Organization and UNICEF, UNDP, the World Bank. All of them had some interest and involvement in health at that time. We also had bilateral agencies. In the US, it was the USAID, in Canada, Canadian CETA, Sweden, Swedish CETA, and so forth. So we had global agencies, bilateral agencies, and non-government agencies. CARE is one of the best known of the non-government agencies from that time. But universities became interested and they developed their own programs, usually with one country or one hospital, where they could send students and faculty in order to get experience in tropical medicine. 55 years ago, I finally went to Africa to work for the first time. And in a health center, I watched as things improved in global health. One disease, smallpox, totally disappeared. And when you think that it killed 300 million people in the 20th century, you can see what a benefit this was to the world. Measles was killing over 3 million children a year, and then down to 2 million and 1 million, finally down to 100,000. Under five mortality continued to decrease. It was a gratifying period of time, a hopeful time, an exciting time, but it was going to get better. Three things happened in recent decades that have speeded the entire program of global health. One of them is when President and Mrs. Carter developed the Carter Center to work on global health. So now we had the ability of politicians getting involved. And your organization has honored the Carters because of what they did. When I would go to a country representing CDC or WHO or UNICEF, I could undoubtedly get an appointment with the Minister of Health. But when Jimmy Carter would go to a country, he would get an appointment with the head of state. And if he convinced the head of state that they should be interested in guinea worm or onchocerciasis or some other tropical disease, you know the Minister of Health was going to be interested in it. And so it was a whole new level of involvement to see what could happen with politicians interested in global health. The second major change in recent decades was the new push by foundations. Bill and Melinda Gates, and you've honored them also. Bill and Melinda Gates, 20 years ago, started the Gates Foundation, and suddenly people were able to get resources to do research on global health problems or to find programs promoting global health programs. And I've often said when the history of global health is written, we will look back at the year about 2000 as the tipping point because of the Gates family. But the third and the last chapter that I want to mention is when corporations became totally interested and involved in global health. And now they could bring together management abilities, they could bring together logistic capacity, an interest in the entire globe. And why did this happen? Because of one person, Roy Vagelos. And many of you know the story that they were able at Merck to develop a drug taken from the soil from a golf course in Japan and develop a drug to protect dogs against heartworm. In the old days, we had to give a drug every day to protect dogs against heartworm. And suddenly Merck comes out with this drug that was licensed under the name HeartGuard. And with it came a little red heart that you would put on your calendar to know the next time you had to give a dose. But one dose a month would protect your dog against heartworm. Really was a miraculous step. But then people at Merck began wondering, could this have human applications? And Bill Campbell went to see Roy Vagelos. Roy was head of research at that time at Merck, and they could tell right from the beginning, there's not going to be a big market for this, even if it's successful. But Roy Vagelos agreed to give money, and they sent Mohammed Aziz, originally from the subcontinent, to Africa to see whether this could protect humans. Now, think of all these global connections. Soil sample from Japan, worked on in a lab in the United States, a scientist from the subcontinent going to Africa, and he did a study to see, could this drug protect humans against onchocerciasis blindness, or river blindness it's called. And of course, it was successful. So now Merck has a drug that's relatively inexpensive, but it's even better in humans than in dogs. You only have to give it once a year. An inexpensive drug given once a year to the poorest people in the world is not a great market plan. You can't make a lot of money on that. Roy Vagelos, by this time, was CEO at Merck, and he made the decision, we will give it away free. And he attempted to give it to WHO. He said, we'll give it free if you figure out how to distribute it. It didn't work out. The bureaucracy was too great. So he offered the same thing to USAID, and they just turned him down. Now he's getting desperate. He goes to the Task Force for Child Survival in Atlanta, makes the same offer. We'll give it free if you figure out how to distribute it. We asked, how long will you give it free? And his response was, as much as necessary for as long as necessary for onchocerciasis in humans. What a breakthrough. And now we had a way to deal with a disease that would empty villages in West Africa, because by age 50, many of the adults were already blind. And so with this program, everything changed and the amount of blindness was reduced in West Africa. But we were concerned, how do you get people to take a drug if they don't see the results for 20 years? That is, they don't go blind. And we worried also, what do you do in what we now call phase 4 studies if we find that a drug has adverse effects that you don't pick up in the phase 3 studies? Well, we were very careful in beginning this, and the bottom line was it's one of the safest drugs that's ever been developed. Number two, you don't have to wait 20 years for results, because this drug turned out to be 100% effective in treating roundworms. And people knew when they had been treated for roundworms. And so suddenly the marketing was easy because they would tell their neighbors about this. But the other part that I had not anticipated, even though I had been living in West Africa, was how this disease was the reason for so many people itching all day long. Some of them would wake up in the morning, the first thing they knew, they were itching. Last thing they remembered at night, they were itching. And suddenly, some of them taking this drug for onchocerciasis had their first itch-free day ever. And they tell their neighbors about it. And of course, this is a great marketing strategy. And so we watched as our goal of reaching 6 million people in 6 years was suddenly reached in 4 years, and then kept increasing. And Merck continued to give free drug for thousands of treatments, then millions of treatments. And years ago, I remember when they crossed the 1 billion mark for free treatments with Mectizan. So a remarkable story. Then one man, John Moores, very interested in this, put up money to develop a sculpture of a small boy leading a blind man with a stick, a very common sight in West Africa during the onchocerciasis days. And this sculpture, life-size, was put in the lobby of the Merck headquarters. I was privileged to be there the day that it was inaugurated. And in my remarks, I said, isn't this strange that people coming to Merck for the first time, as they enter the lobby, they will see this sculpture, which is honoring a drug that Merck makes no money on for human use. Isn't that interesting? Well, John Moores went on then to create a second statue, which he put at the Carter Center. Carter Center had been helping in making this a popular program in West Africa. He then put up money to replicate this, and the sculpture is in the lobby of the World Bank. Now, the World Bank often used to say that they were not a health organization, but of course they do a lot of health things. And they raised money to help distribute Mectizan. Merck was giving it free, but distribution costs were a problem. And so because of their program to raise money for distribution, this was put in the lobby of the World Bank in Washington, D.C. And finally, a fourth replica of the sculpture was placed at WHO in Geneva, the place that was originally unable to actually meet the requirements of Merck to distribute the drug. So it's been a remarkable story of corporations now involved. And now there are dozens of corporations involved. And there's even one program that involves both Merck and Glaxo, where Merck puts up one drug, Mectizan, Glaxo puts up a second one, albendazole, and it's used to treat lymphatic filariasis. So it's a remarkable story and a remarkable chapter when corporations decided to do this. So you can see why I am so pleased with this award and so pleased to have the name Roy Vagelos on it, that it's been a pleasure to work with him over the years. Thank you very much.
On behalf of the Awards Committee and the entire Gallian community dedicated to improving the human condition, we thank Dr. Bill Foege for his inspiration and example.